everyone, and welcome to this session on COVID-19 and its effects on mental health. I will be presenting some potential solutions available through your group benefits program in order to mitigate the impact of the pandemic on the mental health of your employees. My name is Laura Ladine, and I am a consultant at HUB International with experience in group benefits and health consulting. I am also a certified employee benefits specialist, and it is an honor to be your presenter for today's session. You will not be surprised that the current situation is new, dynamic, and in constant evolution. In order to react to quarantine measures or the closure of non-essential businesses, many employers have had to act quickly by implementing work-from-home arrangements, new work-life balance standards, and temporary layoffs. We will not pretend that the solutions proposed here are applicable to your organization, your context, or to your industry. There may be some solutions that are more relevant than others. Professionals unanimously agree that the current situation will have a negative impact on the mental health of your employees and their families. This situation inevitably generates anxiety, either due to the loss of employment, precarious financial situations, social distancing measures, or the fear of contracting the illness. This new reality will not be without consequences. The goal of today's session is to provide advice on the tools that are at your disposal to help mitigate the negative impact on the mental health of your employees and consequently your group benefits program. It is our role as consultants to support your organization in your reflection process and in the implementation of proposed measures. With that, I'll move along with today's agenda. Today, we will be covering the following 4 topics: mental health statistics, which includes a snapshot of the situation before the pandemic; anticipated impact of the pandemic on mental health statistics, which will include a summary of the impact on group benefit costs. We will be presenting a toolbox to help you support your employees and limit financial risks. And finally, we will examine the key steps that will allow you to better collaborate with your insurer. First, a few statistics to show the current state of mental health. Mental health is most likely already on your radar, and we would like to present a few numbers to highlight its importance. The proportion of Canadians dealing with mental health issues has been increasing in recent years. In fact, the percentage of Canadians affected by mental health issues increased from 5.9% in 2015 to 7.7% in 2018. This tendency appears to be continuing in 2019 and 2020. This increase has contributed to mental health issues becoming the #1 cause for long-term disability claims, ranging from 25 to 35% of all long-term disability claims. For short-term disability, the proportion of mental health-related claims is even higher. Increases in long-term disability claims directly translates into an increase in premiums, irrespective of who pays for the premium. Depending on the industry and plan provisions, the direct cost of absenteeism related to mental health is estimated at $500 per employee per year. Other indirect costs not illustrated on this slide will also add to the cost of disability insurance. Now let's take a look at how the pandemic will impact group benefit costs. A recent study from the Society of Actuaries established a relationship between the duration of the period of unemployment and mental health. The longer the duration of employment, the greater the percentage of individuals who were treated for depression. For example, if we look at a period of unemployment of 6 to 11 weeks, the prevalence of treated individuals is 30% greater than for the previous period. When the unemployment period reaches 12 to 26 weeks, that number climbs to 60%. Employees who have been laid off during this pandemic will be at a greater risk of developing mental health issues, especially when considering that the current situation involves quarantine. This parameter was not reflected in the Society of Actuaries study. Now let's take a look at the collateral impact on the group benefits programs. First of all, if there are more employees with mental health issues, there most likely will be an increase in absenteeism. We estimate that the increase in mental health-related disability claims could reach up to 50%. Some of these cases could be prolonged and end up becoming long-term disability claims and incur large reserves as a result. The longer an individual is on a disability claim, the likelihood of them returning to work declines. Secondly, the increase in the incidence of mental health cases will not only affect disability claims, but also the consumption of prescription drugs. After only a few weeks, we have noticed a significant increase in the consumption of drugs typically prescribed to treat anxiety, stress, and depression. Therefore, if a plan sponsor takes no action, these statistics will inevitably translate to an increase in disability premiums. In recent years, disability insurance costs have already seen substantial increases. If we add the impact of COVID-19, this increase could lead to a rise in premiums of up to 25%, which represents approximately $250 per employee for an average plan. Now let us take a look at the potential solutions at your disposal to help you support your employees with their mental health. The list of solutions presented here is to ensure that your organization is best equipped to face the mental health wave that will occur following the reopening of the economy. Like a real toolbox, we invite you to select the tools that will help you build or improve your approach to mental health. The Employee and Family Assistance Program, or EFAP, is an important support tool for employers. For organizations who do not currently offer an EFAP, implementing such a program should be considered. Certain programs may even be available for as little as $1 per employee per month. For organizations that already offer an EFAP, temporarily increasing the number of counseling hours or offering additional services could also be considered. Financial counseling is a great example. Offering mental health training sessions for your managers and your employees is an important part of supporting your employees' mental health. Many EFAP providers already offered such sessions prior to the pandemic, and COVID-19 has only helped in improving their offering. We have noticed a strong interest for telemedicine throughout this lockdown period. This service allows individuals to have access virtually to a physician, similar to a walk-in clinic. This access is very useful in the current context, and this is why many organizations have elected to expedite its implementation. Although this period is temporary, this solution will continue to be beneficial while employees return to work because many individuals will still have to manage work-life balance issues, which may reduce the time that they have for physical consultation with a physician. Please note that telemedicine costs are much more affordable now than they were even a few months ago. Many telemedicine providers have also added mental health components to their service offerings as well. As the access to certain services may be problematic, some programs have been created to provide accelerated access to certain professionals, like psychiatrists within 3 weeks, or even facilitate access to professionals for children such as psychoeducators, educational consultants, and speech therapists. Including these professionals in your plan will help to broaden your benefit group offering. As previously stated, we expect an increase in absenteeism. It is in the interest of the plan sponsors to update your absence management policies and procedures in order to reflect the new reality. One of the issues will be to separate disability cases that are occupational versus non-occupational. In addition, newly established temporary hygiene measures for COVID-19 cases will also have to be implemented. Consulting an external expert or conducting an audit of your procedures could also improve your absence management results. Considering that your human resources department is probably very busy, you may also want to consider outsourcing absence management to an external provider as well. You may have already heard of pharmacogenomics. It consists of a DNA test that uses saliva to validate the compatibility of a patient with certain molecules of certain medications. Reimbursing such tests can be relevant in the context of mental health, where a broad range of medications is available to patients and their physicians. It is common for a trial and error approach to be used in order to find the proper medication and dosage, while minimizing the undesirable side effects. Pharmacogenomics has the potential to considerably reduce this trial and error period and therefore decrease the length of the disability. Many programs have already implemented pharmacogenomics as part of the disability management process. This could also be relevant to offer the reimbursement of these tests for active employees as well. Many of your employees who are still actively at work may be in the process of trying such prescription drugs, and providing pharmacogenomic testing to active employees may help to mitigate a future disability claim. You could also review the coverage for health practitioners, especially for services around mental health. Adding psychoeducators, couple therapists, and psychotherapists could improve the breadth of your offering. A new therapeutic approach is also gaining significant popularity, and this is internet-based cognitive behavioral therapy, also referred to as ICBT. This online therapy, in which a therapist supports a patient virtually, aims at helping people who are dealing with key issues like anxiety and insomnia. This online approach reduces costs and improves accessibility while generating positive results. The reimbursement provisions of your plan could also be reviewed to support your employees and remove or minimize costs that are barriers for individuals accessing care. For example, the annual maximum for psychologists could be temporarily increased, the same for diagnostics related to potential screenings. The addition of preventative vaccines could also be considered. Finally, in order to mitigate the financial risks, you could consider reviewing the financial mechanisms associated with your group benefits program. Introducing stop-loss insurance, pricing guarantees, or proceeding with a plan redesign are good examples. These mechanisms will help manage the financial risks associated with your program. In our last section, we will review how you can better partner with your insurer. Your insurer will play a critical role in the upcoming months. We can expect that the number of disability cases will increase considerably. At the same time, like any other employer, insurers will also have to manage their employees and what they will be going through during these difficult times. Our objective is to avoid a situation where delays occur in the adjudication and payment of claims at a time where employees need it most. Starting now, we encourage you to communicate with your insurer to confirm that the team servicing your organization is in an optimal position to manage your claims and that experienced case managers who know your organization are available. Studies clearly show a direct correlation between the experience level and caseload of a case manager and the duration of those absences. It is not surprising that a case with early intervention from an experienced case manager will lead to a reduction in the duration of the claim. It is important to have a discussion with your insurer regarding strategies that can be immediately adopted to expedite the management of the claim. It is important for the insurer to be able to pay the claim without delays in case that involves quarantine. If the reason is due to an employee having contracted COVID-19, the insurer should be responsible for paying the claim. However, if the quarantine is due to a colleague contracting the virus, the case may be referred to the Provincial Workers' Compensation Board. We recommend that your insurer communicate with you regularly to update you on the status of the claims, both in terms of duration and in terms of number of cases. Most insurers are capable of providing detailed reporting with valuable information, and some of these reports are available in real time. We recommend taking a proactive approach by scheduling recurring meetings as a conference call or video conference. These meetings do not have to be very long. They can be between 15 and 30 minutes, and they can be held every other week. During these recurring meetings, we are confident that your insurer will be transparent and inform you of its capacity to manage the influx of claims. If your insurer has had a hard time managing these increasing demands, agree to an action plan and do not hesitate to reach out to your HUB consultant to have a discussion on potential solutions. Keep in mind that insurers will also have to deal with absenteeism in their disability claim management team as well, and that the increase in the number of cases will make it more difficult for them to manage. Make sure that your organization does not suffer due to this situation. For organizations with a larger number of employees, we recommend having a discussion with your insurer to establish a service level agreement. This agreement must clearly define the roles and responsibilities of the insurer and measures to evaluate the insurer's performance. For example, the initial claim processing time. Agreements also include financial penalties should the performance measures not be attained. Thank you so much for joining us today, and we hope that you found this session was useful for you. Please do not hesitate to reach out to your HUB consultant for more information or if you have any questions on the information that was presented. Please stay tuned for the next session, and we will leave you with an extensive list of relevant and free resources for your use.